Hi, I'm James Harris. I'm a general surgeon practicing at Johns Hopkins, Howard County General Hospital. An inguinal hernia is a protrusion of abdominal contents into the inguinal or groin region. It could be either intra-abdominal fat or intestine that actually protrudes into the groin. It's most commonly seen in men, about 10 times more commonly than in women, and it's largely because of the groin anatomy. During development, when the testicles descend from the abdomen into the scrotum, that actually leaves an area where men are prone to developing a protrusion of abdominal contents into this region. About 1 in 4 men during their lifetime will actually develop a groin hernia. When someone has a hernia, they notice a bulge in their groin area. Sometimes this could be associated with pain. They could also have a experience of fullness in that area when they do heavy lifting, cough. Sometimes when they lay down, they notice that the bulge goes down, and then they get up and they start taking part in physical activity. They notice that the bulge gets bigger. Most of the time, people will experience symptoms, and that's the most common reason someone will come in for treatment of a hernia. If this is something that's detected on physical exam and it's not causing them any problems, quite often you could just do watchful waiting and just follow a patient because of these types of incidental findings. But if it's causing symptoms, or if it's causing any increased bulge or pressure, or any instance of bowel obstruction, then those are situations where it needs to be repaired. The surgery, there are 2 different options. There's either open or a laparoscopic approach. An open approach entails an incision about 4 or 5 centimeters in the groin area, and essentially you identify the area of the hernia, you find the sac, the hernia sac, and you put the abdominal contents back where they're supposed to be, and then you use a piece of mesh to reinforce the repair, and then you close the defect that way. The laparoscopic approach, you use very small incisions, and you use a laparoscopic camera to go through the incisions. The biggest incision would probably be about as wide as my thumbnail. You go in through that incision and then use very tiny instruments through 2 other incisions. Those would be maybe about the size of an eraser head. And you find the area of the defect, and you reduce the abdominal contents back where they're supposed to be, and then you actually place a piece of mesh over that area where the defect was, to stop the abdominal contents from going back into the hernia space. Immediately after surgery, the patient will recover in the post-operative recovery room. It's a same-day operation, so you get to come in, have your operation, then have someone escort you home. Typically, we require some family member to be there because you will be recovering for anesthesia. You usually don't have a whole lot of pain right after surgery because we use some local numbing medication. Most of the pain happens the following day, but we give you pain medication to help take care of that. And you're usually able to wean off of the pain medication after a few days. I prevent people from taking part in any heavy lifting for about 6 weeks because the risk of recurrence is higher if you try to do any heavy lifting, because it puts strain on the repair. But typically people are able to go back to work within the next couple of days. Usually they need to wait until they're off of pain medications before they are able to drive. But typically back to complete normal about 6 weeks. These hernias can recur. Certain people tend to be more prone to recurrence than others. People who are obese, smokers, they have lung disease, they have any kind of connective tissue disease, if they're on steroids, if they take part in heavy lifting, if they're weight lifters. These are things that could cause increased abdominal pressure and could cause more strain on the repair and lead to a recurrence.